this is Dr. Mike Barnes. My friends and colleagues in the field usually call me Dr. B, so feel comfortable with that. And welcome to the introduction to a new podcast that I've decided to put together. It's called Beyond Addiction and Trauma, the Family Recovery Podcast. And it's a podcast that is really a passion project of mine. I grew up in a family with addiction in multiple generations. 42 years ago, I graduated from graduate school, and I became an addiction counselor. So I've been passionate about working with clients and their families with addiction. I went back to Florida State University and got my PhD in marriage and family therapy in 1995. So that's about 30 years that I've really been working with families who, like mine and like so many others, struggled with addiction, either in current or, in our case, past generations. And so I've really focused the vast majority of my career on helping families and clients kind of come to terms with and heal from addiction and trauma. So the podcast is really designed to assist family members who are struggling with a loved one's addiction and the trauma that's really so commonly associated with it, and to help families with the secondary trauma that they experience when a loved one is wrestling with addiction. But it's also for therapists and counselors who work with families and who want to gain a better understanding and learn more about how to assist families as they kind of grapple with the impacts of addiction and trauma in their lives. And so I am the founder and the director of the Michael Barnes Family Institute, which is part of a larger behavioral health system called NRT Behavioral Health, which stands for The Next Right Thing, in Broomfield, Colorado. I am located in Tampa. And it's a program that provides coaching, education, and social support for families. And when I think about that, I think about the first words that I ever wrote when I was writing my book. I wrote a book in 2023 called When the Solution Becomes the Problem, Helping Families Healing or Struggling with Addiction and Trauma. And the first words I wrote were that most people who write books for families struggling with addiction and trauma write that to tell them what to do and how to do it. My book was different. It was a book about why it's so hard to do the things that people tell you to do. And this podcast is really built on the same kind of philosophy that a lot of times families have reached out. I've been asked, 1,000 times, what do you think we should do? And when I have told people what I think they should do, I find that they often don't do it because it's so hard. They have to understand the issue a little more differently. So this podcast is built on a philosophy of education, coaching, and social support as key elements to family healing and family beginning to address these issues. And so the format for this podcast is going to vary. Sometimes it's going to be me doing a kind of a little mini lecture on some aspect of family recovery that I think is critical, that we're seeing in our program, that families are wrestling with this certain aspect of that. Other weeks, I'm going to have Annie Camacho and Jana Brown, who are a therapist and coach in our family program, who will come on and kind of bring in the most recent issues that families are wrestling with, frequently asked questions that we get, those kinds of things. And other weeks, I'll have colleagues, people who are professionals in the field, who bring their own expertise, their own philosophy to help families, and we will sort of unpack, what they have to say with what our viewers have to say. And so I would ask you to please, write. My email is mike.barnes@nrtbh.com, and I would urge you to send questions to me. What topics are you wanting? What's missing in the work that you've been doing? And we will try to make this a collaborative process to help those who are, part of the podcast community to get the most out of it that we can. And I guess finally, the most important thing is that it's built on a philosophy of addiction as a chronic illness. And chronic disease management does not say if a loved one gets sober, the family gets healthy. Because so often families will say to me, hey, if my loved one would just get sober, we could go back to normal. Well, that's not, I mean, it makes sense on one level, but that's not really what we find. The research tells us that when families come together and begin to recognize that they have been as impacted by this chronic illness as their loved one, and that they begin to kind of recognize that we are all dealing with this illness. We're all needing to heal from this illness. And when family members begin to recognize the need for their own growth and their own healing, that the family moves away from, well, we're here to support my loved one's recovery, to a much more effective and useful process that says we are here as a family in recovery from addiction and trauma. So welcome to the podcast. Thanks for watching this intro. I hope you find it helpful and communicate. Let me know what you're thinking. Thanks.